Welcome to EduSet Network, dear friend. In the series of the social work education, we have covered a number of topics right from the beginning of social work education, origin, growth, development, its various methods, values, ethics. Today we have chosen to start with the social work practice in different areas. And today's topic is very relevant, very important, and the newer one, social work practice in HIV/AIDS. Now, we will discuss today the social work practice in the field of HIV/AIDS, where the social workers participate, what they do, what they can do, why they do, how they can do. Number of things we will discuss today in this lecture. And the lecture intends to, for the beginners, to understand the connectivity between the social work practice and HIV/AIDS. HIV/AIDS is a lifestyle disease. It is related with the behavior of the people. And you all know that HIV is caused by a virus, human immunovirus, that causes a disease which is called AIDS, a disease that limits the body's ability to fight with the infections. It makes the very weak immune system, and there is no medical cure as such, though the efforts are going on and some people claim that there is a treatment, but still the prevention is the best treatment for HIV. The AIDS, the acquired immuno syndrome, is now not unknown to everyone. I mean, there is so much discussion, debate, information, campaign, that the AIDS has become now a very familiar name. Still, there are number of issues which are connected with the AIDS, and as a social work practitioner and as a social work student, we should understand what is the connectivity between these two and how we should address the issues related to the HIV/AIDS. In the HIV/AIDS, there are 4 stages. The primary stage, when the virus enters, there are asymptomatic stage, number 2, the third stage is symptomatic, and fourth stage is HIV when grown in a form of AIDS, and the symptoms of the AIDS become more, the immune system starts getting weak, infected, and there are more opportunistic infection associated with the AIDS. The route through which the infection goes is through the contact, blood, and large number of goes through the sexual contact. So, you know all these familiarities because there is a lot of information campaign, and I believe that as students of master's level in social work, you must have come across through in your field work and other places. Now, little bit about what is the situation of HIV/AIDS prevalence. There is a national organization called National AIDS Control Organization, NACO, and NACO publishes the data every year, and in 2014 it published the data after the surveillance of HIV. About HIV prevalence, there is a 0.27% HIV prevalence rate. The number of PLHA is called people living with HIV and AIDS. Earlier it is called PLWA, people living with AIDS, but now the new nomenclature PLHA, that people living with HIV and AIDS are 20,88,638. And number of CHLA, number of children living with HIV AIDS, 1,45,446, and the new infections is 1,16,459, and the country has witnessed the AIDS related death 1,47,729. Now, this data gives us an idea that the disease is quite prevalent, and in the field of public health in last 20 years, rather around 28-29 years, we are fighting with this disease very heavily. So, now the idea when we say disease, I mean it is that it has to be handled by the doctors, not by the social work people. But as I told you that the prevention is the best cure for HIV AIDS, and there are number of preventive mechanisms, because this disease is linked with the behavior of the people and lifestyle of the people. So, the professional social work or social workers appear. What is this professional social work? We have already explained, but briefly we will go. This is a social work mission is to enhance the well-being of human well-being or well-being of the people, started from the altruism, philanthropy, charity. It has grown as a newer science of interacting with people, trying to understand their problems and needs and problem, and to find out a balance, create a resemblance, to address the social change, to ensure the social justice to the people, and to also ensure that in the process of health their dignity is being protected. So, the core values of the social work, of course, the service with social justice, human right, the dignity and birth of a person, believe in the importance of the human relationship, integrity and competence, the sum of the core values, and the other values we have discussed in other few videos earlier. Now, social work is an academic discipline and it is a practice based profession, and for that if you want to see, I will refer you to see the global definition of social work, which was accepted by the International Fraternity of Social Workers in July 14. And you must read the social work definition. Here we do not have time to explain it in that, but I will be interweaving it into the discussion. Now, the social work mission is to empower vulnerables, the empowerment process, empowering the people, those who are vulnerable. In a health setting and also in few other setting, which is health setting which is largely dominated by the hospital system and doctors, what is the place of a social worker and how they work? Social worker work in the context of a multidisciplinary team, providing support for those living with a chronic illness, including HIV/AIDS. So, team members include doctor, nurse, practitioners, physician, pharmacist, psychologist, psychiatrist, immunologist, people from the public health, and many others. So, this is a complex subsystem of the society. Health in itself is a very complex subsystem. It operates at primary, secondary and tertiary level. It works as a preventive to the treatment and after treatment. So, the social worker has a place in the health setting where it has to play a very important role, and it provides the services of various nature, right from prevention part of the management diagnosis of the treatment plan, if not treatment directly, not to be misunderstood. Counseling, it provides the training, research, education, capacity building, behavioral communication, the advocacy, and so on and so forth. If they diagrammatically in any assessment and treatment planning, these team members operate in a healthcare system. Now, particularly we will come back to the main topic. When we say that HIV/AIDS is the new emerging area, it has already seen the witnessed all over the world. It came in a form of a pandemic. The HIV/AIDS crosses all field of practice, including public, mental health, community development, and healthcare. HIV/AIDS is not only a problem of medical nature, and health is an issue which is a part of the development, and it is very closely connected. So, HIV/AIDS should not be seen only in terms of a communicable disease or disease which has to be transmitted from one person to other person through the 2-3 routes which are very popular, blood contacts and HIV/AIDS and mother to child contact. But this area is evolving because the people, those who were infected or affected with this disease, have to be taken care at different stages. Those who have just acquired the HIV infection, the management of the STI and RTIs, sexually transmitted infections or reproductive tract infections, to the treatment where it has been declared that it has fully blown AIDS, and the person has to go on to the ART treatment. So, the issues of adherence into the ART treatment and the issues of following a particular lifestyle during the course of HIV/AIDS. It is not that a HIV/AIDS person will die within a day or within a year. He can prolong, and it has to improve the quality of life. So, the whole effort of the social worker is to improve the quality of a life of a PLHA. I will use the word PLHA for the sake of convenience, but you should always remember that PLHA means person living with HIV/AIDS. So, we support to the people with the disease and through direct counseling, treatment intervention, and also with the social justice activities we will explain to you. Now, working with these vulnerable, poor, marginalized is the purpose of social work, and social work practice also address the individual and social problems. Now, as a person, as a PLHA has an impact after contracting this disease or affected by the virus at individual level, and it has a social problem. You are very well aware that AIDS in the very beginning stage has a lot of social stigma. People do not want to touch the person who has an AIDS, and there were so many myths and misconceptions, many rumors and gossips about the AIDS patient, and even about the disease, that this disease is a Western disease, it has been imported here, and lot many community rumor mongers, and so much so that we have witnessed the cases where the AIDS people, the person who died with the AIDS, the villagers have refused to provide the place for cremation. So, that was the strong discrimination or strong stigma attached to this disease, and working and addressing the individual and social problem of that nature is the part of the social work practice. Now, when we say that it is empowering profession, what does we mean by empowering profession? That social work empowers the client system. Client system means the person to whom we are providing the services, to the client system, and develop the competencies, competencies of a person. So, we try to develop the competencies, enables the social structures, help the making improvement into the social structures, and relive the human sufferings and social problems. So, social work has set itself for a bigger goal, and when we have started the different kind of approaches, the Mayer and ecosystem approach, and followed by that Germain and Gitterman in a ecological life model, and Malicio in 1981 is a client competency model, have started giving the dual perspective to the social work interventions, that it has to intervene at the individual level and it has to see the person in situation, that client in a situation, in a ecological framework, in an environmental model, that there is a interaction between person and environment and influencing and interacting between both of them. So, person in situation is a very important, and that is why we have to work at different level. For that, social workers are quite equipped, they have skills, they possess the knowledge about the disease, knowledge about the human behavior, knowledge about managing the individual problem, or knowledge about the social problems, the community behavior, the community response, the group people. So, they have a skill to work effectively with PLHA, and at different level it has a different skills. Now, the social workers not alone work with the PLHA, they also work with the family members, the friends, the partner, the spouse and the children of that. So, disease is not affecting only one person. In fact, disease is affecting the entire family and the entire relationship pattern within the family, and these relationship pattern which are based on lot of trust and mutual support, they get somewhere affected. So, the social workers have to skill for working with this kind of, and it also work with the unique skills of working with people. When we say people at different level, individual, group and community level, and even at the societal level, within the context of environment, and advocating change that the best meets the needs of the client. You know, in terms of making changes into the system so that people get lesser affected. Now, HIV AIDS, as I told you, its source and roots, it has certain occupations which have a higher risk occupation. So, we call them in high risk occupations. Like occupations, these occupations by nature are designed or are nature as such, where there is a more chances to get HIV infection, like the truckers, you know, operating from one place to other places, the commercial sex workers, they are likely to affect it. The MSM, men having sex with the men, the drug users, because using the single same syringe by a group of drug users transmitting the. So, these are called the high risk groups. Now, the another one high risk group is the migrant workers leaving family behind and using the sex services into the city and getting infected, and this infection pass on to the spouse. So, the care of people living with HIV AIDS and PHA, another issue is working with the community attitudes, that we work with the community, those who have their different attitude towards the disease. While working as a social worker, as a health promoter, there has been certain guidelines which WHO has issued in 1999, and they says that the 4 things that for a social worker, that be informed, you should be abreast with the fresh knowledge, the new information, you should be bold enough to take the intervention, to challenge the stereotype, to question the myths, to question the misconceptions, to discover the sexuality, to talk about the sexuality issues. And while working with as a health promoter or on the health issues like HIV and AIDS, you have to be very clear, simple, straight, precise, directly talking to the people without much technical jargon. The people can understand your communication. And the 4th is that you have to avoid stereotyping and blaming, that these HIV AIDS people are not stereotyped, not having the same kind of things, all people, those who have the HIV AIDS, they are bad character or bad people. So, blaming, social blaming, that's. Now, there are different kinds of intervention. Before I go for the intervention, I will tell you that Government of India through its nodal organizations NACO, National AIDS Control Organization, has created a network to work with the people affected with the HIV/AIDS and to counter this problem. So, this NACO has created a infrastructure the countrywide. At every state there is a state AIDS control societies, and these state AIDS control societies operates in every states, and they operates with the help of the civil society groups, hospitals, medical system, and they operate at different level, into the districts and villages and all. So, many approaches has been adopted, and we have a National AIDS Control Plan NACP 1, then for 5 years for another, followed by this to NACP 2, then NACP 3, and now we are at the 4th stage where we have a national plan which called the 4th stage national plan. The government has provided many services, the STI and RTI services. STI, I told you, sexually transmitted infections and reproductive tract infections, and there are more than 1115 clinics, and 67 lakhs episodes of STI has been treated the countrywide. Another very important preventive mechanism is the condom promotion, which has been questioned by the many religious leaders and other people on the other belief. But condom is one which is a preventive mechanism to further transmit disease from one person to other, and there is a risk for having anybody can be contacting this disease. So, the risk perception is too high for this disease. The number of condom outlets which has been created were roughly 8,17,000, and a huge amount of condoms have been sold on the sometimes free and sometimes through social marketing mechanism. The idea was that people should use it, and this will help the people in reducing the infection. Now, when we say that the HIV/AIDS people are vulnerable, they need the information, and information alone is not sufficient. They need the information which works as a changing their behavior. So, the lot of IEC communication, information education communication, has been created by the NACO, and if I go by that, there are many innovative programs came up where the social workers were also engaged, like Red Ribbon Club. Red Ribbon Clubs, where the activities has to be done at the youth level in colleges and universities, and with the help of NYK and NSS, Nehru Yuvak Kendra and National Service Scheme. And this Red Ribbon Club has been more than 3,134 Red Ribbon Club has been established across the country, and then they have been making the information, spreading the information to the among the youth and as well as the other communities. So, that has been another technical program which not many social workers is engaged, but of course, the social work people were engaged into the blood collection. Blood is the only thing which cannot be artificially prepared, and blood is the source of transmission of the HIV/AIDS. So, the blood safety program is one of the core program of prevention of the HIV/AIDS. Now, collecting blood voluntarily from the people and from the healthy people is one of the greatest tasks. So, many social work people, they have been engaged in this kind of activities through NGOs and many other religious and spiritual and philanthropic organizations to collect the blood, and then blood has to be checked and screened for the HIV infection and to be sent to the. So, we have always the scarcity of the blood, and therefore, the blood first taking blood voluntarily from the people, from the community, and then creating the banks for that, and that too the safe blood was our major priority. Now, the biggest program which through the SECS, State AIDS Control Society, the NACO has initiated is the targeted intervention program. So, the intervention which are the targeted intervention, why I say targeted intervention, because they target one high risk group or a population. So, targeting intervention for commercial sex workers, for migrant workers, for drug users, for truckers, so those has been launched into the to the country, and more than 2000 TIs, we called it in short form TIs, which has been and one TI caters the need of one high risk group in one zone, and there is a complete staff available for this TI and to make operational into that area. And for these people, those who are working in TI, project manager, counselors, outreach workers, peer educators, what we need to train them and to build their capacities, capacity building of the people, those who are providing HIV/AIDS services. So, in capacity building programs, social workers were involved, and social worker has a role, like for building the capacity building program and for targeted intervention in Delhi. In my university, we have run a state training and resource center for 5 years, and most of the project officer and training officers were socially trained, they were MSWs, and they were providing training to the TI personnel to the whole of the Delhi, where more than 130 TI programs were operational for 5 years. So, repeatedly doing training and building their capacities to reach out to the people, those who are infected, and to reach out the people to inform them about the disease and how to manage the disease and how to be the preventional program, was one of the major tasks, which involves many multidisciplinary strategies and multiple strategies at different level at different points. So, this was the another intervention which was the behavior change communication. This is somewhat different, I will come little later to tell you that how behavior change communication is different the awareness building. It is more than the awareness building. The awareness building is one part, but of course, bringing awareness is one of our area, but beyond that, how to change the people's behavior to thinking pattern, that was. Then the counseling to the people, those who are coming for HIV testing, that only person will come to know whether he has an HIV virus in the blood, what we call HIV positive or HIV negative. Now, for that you require the HIV testing, and for HIV testing, before going the test, the kind of upheavals is going in the mind of a person, he needs a counseling. So, pre-test counseling, that before going to the test of HIV/AIDS, what we call ELISA test, through which we try to find out virus, whether HIV virus, the person has to be counseled and he has to be made comfortable, and the whole period. Now, again, if suppose somebody has been found HIV positive, how to communicate? The post-test counseling, both are very technical issues, and people from social science and behavioral science discipline, including the social work professionals, have a major role to play in the counseling of that. And counseling does not stop only the test, pre-test or post-test. After that, somebody has acquired the HIV/AIDS, how to keep this counseling process going on with the person is a really difficult task. And it is not simply, counseling is not simply to tell something people and advise certain things to the person, or just to dictate that you should not do this. It is not should not. It is something which has to be imbibed and which has to be transmitted in such a manner without offending his dignity, and realizing that people have many psychological strains when they are being suffering with this problem. Besides that, we have a direct services providing the resources, providing the support to the communities, working with the NGOs, directly working with the PLHAs, directly working with the CHLAs, directly working with the families, those who are affected with the HIV/AIDS. And one of the intervention is networking, create a networks of the services, networks of the organization, even networks of the people living with HIV/AIDS. So, they can understand each other's problem, on the pattern of Alcohol Anonymous, we have created the groups, how one HIV AIDS person, and of course, without this all has to be done with the prior consent of the person who is suffering with the HIV AIDS. So, liaising between different departments and different people, making advocacy for changing the programs, the changes in the policy, and that is what. So, it appears that HIV AIDS is a disease contracted by one person, but there is a complete life pattern has changed, and it is destroying the whole fabrics of the relationship. So, social workers also provides therapy and counseling for concern such as new diagnosis, what I told you after the post test, disclosures, how to make a disclosure, intimate partner, the violence, partner violence, that after coming to know that somebody is suffering with the HIV AIDS, having the HIV positive, the other partner's anger of cheating him, creating mistrust, because we have a society where we have a monogamous relationship, and the relationship between the spouse based on the trust and mutual support and mutual respect, and that basic trust where is being felt the cheated, and that creates some sort of a storm within the person and violence takes place. The other way around is that some people gets angry over this and some people go into the depression. So, depression is another consequential impact, and it is also related with the the whether they have the child in future or not, the fertility issues, the anxiety about life, anxiety about people, anxiety about situation, anxiety about social relationships, and finally, when any person who has affected by the HIV AIDS dies, the grief and loss to the family, all these are the very intricate issue, and every issue demands a complete intervention of social workers. And social workers either providing as a private practice to counseling to the grief family, or as a part of an NGO, or as a part of a government project, whatever capacity it is providing the services, these services are very important. Now, this is a part of services. When I was talking of the direct services again and again, there are different levels, at one individual level where we are doing counseling to the person, there is a familiarity with the other issues which will require to survive into that process. The person when is getting HIV AIDS, the PLHA is a weak and it has a weak immune system, so falling ill again and again. Its CD count is affecting all the time. So, to maintain the CD count for having the biological activity and having the gene and work without having affected with the disease and its consequential system, you have to work with the many other institutions. The biggest is the income support. Any person who is suffering with this, and most of vulnerabilities, when we were talking of the vulnerabilities of the HIV AIDS people, I was trying to emphasize that the vulnerabilities is because of the 4-5 regions. One is the risk perception, that there is a lesser risk perception, people believe that they will not be infected by HIV AIDS, and people coming from marginalized and economically poor section of the society, they get more infection because they have a more faith and they believe that they will not be infected. The awareness about the HIV AIDS is too low, and because people do not know the pro and cons and having lot of many risk and people are living on the risk behavior. The attitude and perception about the life, attitude and perception about the disease, attitude and perceptions about the responsibilities, are not being very seriously addressed by the people unless until they meet with some kind of accident in life. The health seeking behavior, people do not go to the doctor or to a hospital, they are not very tuned unless until they will put down. Somebody is suffering with the fever, minor fever, do not take care here. He will lay self medication, will go on the peer advised medication, popular medication. If you have a headache, then take a anacin. If you have a fever, then take a crocin. And people go on. It's like people have the cough and cold and coughing for 5-6 months, taking sometimes Ayurvedic drugs and sometimes cough syrups without going to the doctor, trying to find out whether they are developing some kind. So, health seeking behavior is very poor. I mean, it is not very responsive. People do not take responsibly the health seeking behavior. So, at individual level, what we require, the income support to the families at the during particularly that period where they are being suffering with the disease and not able to earn. So, they are doubly impacted. One, that the income has been stopped. Second, they have to make expenditure on the treatment. And in absence of a general insurance system or social security system in our country, the income support or income maintenance is not possible. So, the only left out is either charity or go to the NGO and taking care from their own resources. So, this social worker has knowledge and familiarity of the different community resources which provides the income support. That is the another job of social worker. Working with the government systems, various kind of pensions, financial support for available for treatment, grants available, knowledge about the schemes. The education and training program, the career planning, shifting of a person from one job to other job because now he cannot continue with that job which require the heavy investment or heavy loaded work, he might be requiring a light work. So, making the career shift and career changes. Lot of drug programs, what kind of drugs and HIV drugs are costly, how to get it, from where to get it, how to take the services of ART clinic, how to get registration there, how to use this, adhere to the program of the drug regime. All this is a part of the social worker's requirement, especially where vulnerability is high, where people are illiterate, where people are uneducated, where people are not able to understand the complexities of the disease, the short term and long term disability programs. Many people are disabled in the terms of after affected the disease, accidents, the level of working is down. The human right legislation, the issues of discrimination and isolation and separation, the stigma that social worker has to take at individual level, de-addiction services. Above all, the legal services, what are the legal rights available to a HIV/AIDS patient? The employer has thrown him out because he does not want to continue him with his workforce. So, he threw him out. Now, how to contact with this employer and try to convince him? Resources for the people, those who are LGBT, lesbian, gay and so bisexual and transgenders, their issues, because that is also another very high risk group which involves the transmittance of the HIV and AIDS. Nutrition and food security, how to ensure the nutrition, because this disease demands the nutritive diets to maintain the level, CD count level in the body, protein and other components. And while we are in process of empowering the clients to take his decisions, we have to take the informed consent and informed decisions for him. Now, at the community level, through community organization and policy development, advocacy on behalf of PLHA, education to reduce the incidence of HIV through harm reduction and health promotion. Social workers understand that healthcare is an important issue. And if you look at the determinants of health, roughly 12 determinants which are related to the health and well-being of the people, they have a connectivity with the disease, like social status, income, education, social support network. Social support is a one major thing. In India, we have a lot of social support system based on our friends, relatives, peer group, family. Family is one of the best social support agency. Friends, colleagues. Now, these are the determinants which decides the health of and its impact on the overall well-being. So, taking into this care, most of the HIV/AIDS patients get the poor on these determinants level. They loses contacts with their relatives, with their friends, with their colleagues, probably on one pretext, what people will say, what we call usually in Hindi, log kya kahenge. And because of that, we stop making connections and making contacts. So, we try to exclude ourselves and we try to minimize our area of operation, and the society further makes the social exclusion. It makes you excluded from the system and on the basis of. So, social worker has another job to strive to eradicate the social exclusion and poverty across all the field of practice. Now, working with the social institution, if there is a satsang going on at some place and somebody come to know that he is HIV/AIDS patient, people do not accept him. So, at the social functions, at the cultural functions, at the religious functions, the people start getting themselves withdrawn and excluded. I was talking to the behavioral change communication, and the difference between behavioral change communication and awareness. For the students of the social work, this is very important to understand. Behavioral change communication is a dialogue. It is an informed choice by the individuals. We contact to the client, we tell him the consequences, while awareness is a monologue process. We went in the community, tried to tell them something, dictate them, and we did the dictation from outside. You should do this, you should not do this. HIV/AIDS is bad, AIDS is a bad disease, it's a killer disease, something like that. So, behavioral change communication is an involved process, where the organized communication intervention and processes are aimed at influencing social and community norms and promote the individual behavior change. While at the awareness level, we use the IEC material. This is used for the mass media and steering the awareness, but here this is a very well designed communication intervention. Suppose there is a group of truckers, so let him understand the socio-economics politics of the trucking community. Let him understand the implications of work. While he is 15 days out of the house, there is a complete new economy develops. In any trucking center if you go, you will find all the cheap products available for a trucker, right from soap case to the cloths to the undergarments to the towel, all is in one package at very small places, use and throw material. This is a new economy, and similarly there are services available. You will find where the truck stops into the mandi and transport centers, those locale, and have their own economy, and the many professions and occupations and services are available for these drivers and their associates for that. So, if you have to work with this community, or you have to work with the transgenders or what eunuchs or hijra community or bisexual or the gay or the lesbians, these are the specific groups which have their own patterns and own normative behaviors. So, very organized communication with these groups will make a change communication. You have to develop a supportive environment for desired behavior change and maintenance of the safe behavior. where this is not information based, this is also practice based. So, BCC is what you can see and deliver and you can learn with from the. So, as a BCC agent or BCC person or as a social worker trying to use the BCC, you have to work with the people and show them that how safe behavior they can have. It also aims to develop interpersonal skills to enhance the client's provider interaction. It is not my way of telling the people, it is the people way to accepting how they have to change their behavior and how their skills have to be generated, how to be developed and how their competencies has to be developed. That is what so it decreases the risky behavior. While in awareness programs, it only develops impart the knowledge. We do not know their reaction and how much how much they have received, because they are not involved. They may be listeners, but not maybe so this is how. And even high level awareness does not involve into risky behavior. People have a high level awareness, but their behavior is still risky. The very simple example is that every cigarette packet or every pouch of a gutka contains the statutory warning, but people smoke, people eat the gutka, they chew the tobacco. So, if you ask them, they will tell you. Sometimes they will smoke and they will say, oh well, I know with this smoke, it is going in my lungs, and I have seen that advertisement also where something is coming out from. They know it, but it does not stop him to taking this risky behavior. But when you have an intended organized communication program with a small one-to-one basis or one-to-group basis and engage them, that might change their behavior, because they can understand and they can. So, by informing, of course, I am not denying the importance of the, but in the HIV/AIDS field, now if you ask me that BCC identifies the relevant audience, whereas the awareness is for the mass level, mass media. And many activities under the crafting messages, use of print and broadcast media to each other. One very important thing is that there are researches available which shows that many print or broadcast messages which we deliver are not reaching to the intended people, those who are supposed to use it. Like truckers and like eunuchs, they do not see many of your television programs where the messages is percolated for them. But activities under the BCC are very much focused, they are defined for the audience, they are based on the researches and issues to the audience. So, further new issues are generated, the messages are designed and crafted for them. The use of interpersonal print and broadcast media is also taken under the BCC, but its designing and delivery is a little bit different what we do at the awareness level. Move from individual to community to state, it is a slow process of and sequential process of movement into the BCC and all that. Now, having said so, we have been always focusing, and I also said in the earning that human right is one of the important issue for the social worker. In fact, social justice and human rights are the two pillars of the social work profession on which the process of empowering people gets the support and strength. So, it is the human right which is every person has fundamental rights, and besides the fundamental rights, the three most important rights in the HIV scenario are right to informed consent, right to confidentiality, and right against discrimination. And there can be no valid or effective response to the HIV/AIDS programs without respect for the human right, fundamental freedom, and to the dignity of human being. Now, social work people are more close to the value wise to the human dignity and dignity of human being and human rights. So, this is very important to understand what are the 3 important rights? Right to informed consent. The implications of HIV are very different from most other illness. Testing for HIV requires specific and informed consent of the person being tested, and any research on data of HIV positive people, the person who is involved must be informed and taken into the consideration. You don't do the breach. You came to donate the blood and I tried to test you, and then I tell you that you are. If I have to test you for the HIV positive or negativity, we have to inform the person that you are going to test. Then right to confidentiality. A person has right to keep information on HIV status confidential. If I inform to my employer that I am HIV positive, my employer has no right to violate my privacy. It has to keep informed. It has to keep confidential. And while they can have the suppression of my identity by using a pseudonym, and pseudonym can be used, but my identity should not be disclosed, particularly because it has the many implications. And if suppose somebody is breaching the confidentiality, the PLHA right to seek justice through the court. They can go to the court of law. Same is with the right against discrimination. The right to be treated equally is a fundamental right, right to equality, and equal access to all, and equal opportunities to all. And this is a very, whether it is something as simple as using a public well or public place or public toilet, or something very serious that some housing society denies me a house in because I am an HIV/AIDS positive. So, any kind of discrimination based on my HIV status is challengeable, and it should not be done. And finally, I will come to conclude my talk with one major issue. The PLHA, when going under the process of treatment, they have to go to the ART clinics, and the care, support and treatment which is to be provided to the PLHA, ART clinic are part of that. Though we have number of clinics, not too many, but they spread throughout the country, and we provide more than 8 to 10 lakhs people the ART treatment, the drugs which is very costly, and it has to be given through the ART clinic. Now, what has been realized over a period of a time, that people do take the drug, but they do not use it. The time, regularity, interval. So, adherence in the treatment, to be in the state of adherence, to follow a prescribed course of action, to check the relapse. Therefore, non-adherence is a big issue, and it is a social worker responsibility. That how to help the people, those who have not adhering, and why people do not adhere to the treatment. It is their treatment, it is their life, because many a times people do not understand the significance of this treatment, that how continuity is important. Like the case of tuberculosis, the DOTS program. If the patient is taking medicine for some time and stops after that, it gets resistant to that medicine. So, now we are treating for the MDR TB. To have that resistance, if people are leaving that program in between, therefore, adherence is a very big issue, and where the social worker has to use its multiple skills to work on the HIV/AIDS patient on the PLHA. Now, there are other issues like research. The School of Social Work or social work students have 100 areas to research because knowledge is never sufficient, and all the time you need new knowledge. So, the researches must go on to the behavioral part. It is a lifestyle disease, and right to confidentiality and discrimination. Many people are not willing to share the information. So, researches are not simple, they are difficult. The people are diffused in the whole population. The HIV/AIDS people are living into that. They are not living in some separate house or separate group society. So, it is not easier to find out. The continuous survey, India has one of the best survey system, Sentinel survey, which it does for the HIV/AIDS. So, the best system in the world to find out. Now, how to make the issues more researchable? This is another area for social work students. Researches are not sufficient. Of course, in last 25 years, lot many researches have been done with the specific groups, with one group, with other group, and it has helped the people, but still more research issues, ethical issues into the HIV/AIDS treatment, adherence and non-adherence, the role of different people, 1000 issues to be researched, advocacy with the government. Like I talked of the income support, the pension, the people, those who are suffering with the HIV/AIDS, not able to work, do they need support from the state? Will state support them? If yes, in what manner? How much support they need it? All these areas are to be issues of the advocacy. HIV/AIDS people and their employment issues, the marriages of their children, relationship, societal reaction, social response, number of issues to be. We need probably a campaign and movement to tell the people on continuous basis, though there are many messages and all. So, finally, I would like to say, dear viewers and dear students of social work, that issues are too many. I have just pointed out the issues and how to work it and what is the role of social workers. Hope this will give you an idea why social work practice in HIV/AIDS, and if you have any queries and doubts and reflections and comments, you can send it to me or to the EduSet address. So, thank you very much for listening, and hope that you must have enjoyed this.